It's estimated that nearly 5% of babies are born with abnormally shaped or prominent ears. Dr. David Gault, one of the world's leading ear specialists, has recently devised a very simple device which could solve the problem in a matter of weeks without the need for distressing surgery. Well, David's here today, along with Mary McLoughlin and 4-month-old Ava, who you might have just heard, who's currently wearing David's EarBuddies, as you can see right there, being taped back at the moment. We'll talk about that in just a minute. David, first of all, a very interesting story about how you kind of got into this and helped kind of devise EarBuddies, and it was to do with one of your own children.
Yes, interestingly, my son, who's now 14, had a funny kink, if I can describe it. It's sort of like that, an abnormal fold in the ear.
Yeah. Which
is the devil of a job to treat surgically, and we just moulded it with a little splint and found out that after a few weeks it had hardened in the right place.
And years later...
It's fine.
It's absolutely fine. So what would happen in the past? They would have just left something like that, would they?
I think over the last 30 years or so, people have been looking at ways of reshaping the ear, because the ear at birth is very, very floppy. It's like a wet piece of blotting paper, if you like. And as long as you hold the shape of how it is when it's born or a few days after, it'll harden in a good position. The mums, I think, are responsible for the floppiness of the ear, because their hormones have an effect on the cartilage and make it particularly wobbly.
The mothers are to blame then, in a nicest possible way. So, which brings me to you, Mary. Really, the whole thing is, it's not really an embarrassing thing, but you worry about your child growing up with slightly odd-shaped ears. So if your baby is born with one, like Ava, what was wrong with Ava's ears?
Well, the right one in particular is protruding.
And so it's something you'd like to correct, really, for the baby's benefit?
Definitely.
And so how did you hear about EarBuddies?
Well, when I took Ava for her 6-week check, my GP referred me to Dr. Gault.
Really? So it is kind of out there then? Is it on the NHS?
As far as I can remember, we met in an NHS hospital and the splints were fitted. If you like, I'm trying to do myself out of business. It's a bit like, you know, the neurosurgeons used to sew up head injuries many years ago. We wear seat belts now and don't hit the windscreen so much. So this is a version of that, where we're trying to prevent the ear requiring an operation later on in life.
And was that just down to you having a GP that kind of knew about them? I mean, do all GPs know about EarBuddies?
It would be nice if they did. I wasn't certainly talking about it in medical school, but it's one of these things that we're starting to put forward as a piece of information for everyone to latch onto, so that if you do want to reshape the ear without the need of surgery, they can.
OK, so let's talk about Ava. Ava was born with a protruding ear. Different to it was just her right ear, or was it both ears?
I think the other one is a little protruding too, but not anything like as bad, really.
And so, OK, well, perhaps Dave, you can tell us how did the EarBuddies work? I mean, you put the splint in to shape the ear in the correct way, and it just stays there, holds the ear in place. Is that what happens?
Yes. If you don't do anything about the ear early on in life, it'll just sort of harden in the position it's in. And children have very little neck. I don't mean to be rude about these little balls of fun, but they don't have much neck. And their shoulder comes forward and hits the ear when it's protruding and makes it go even further forward, and sometimes they're sleeping abnormally. And if you just try and control it gently, put the splint in, which fits in... you can have a look at a splint.
Yeah, let's have a look. And you leave it in 24 hours a day?
Well, you tape it in, and you leave it in until the tapes need changing, really, and that could be 3 weeks, 2 weeks, whatever. But it's a little splint here, and if you take... I'm sorry, this is... I often make ears, but this is a little model of an ear.
Can I just...
And if you hold that up, and the splint would fit just in that little groove there to try and make it.
Let me hold up there so the camera can see. So you literally just slide the splint in there,
tape it in.
To the ear, tape it in.
And a lot of people don't have... I don't know, where are we? Over there somewhere? Anyway, a lot of people don't have this fold in their ear, and it's sort of bowed forwards like that, and so we're trying to bend the ear back and create that fold there. And other people, the whole bowl of the ear is quite prominent, so you reshape that bit, tape it in, make that fold, and then strap the whole ear back.
How long does it have to stay in?
It depends when you start. If you catch the problem at birth, I think a splint for as little as 2 weeks would maybe sort the problem out.
Solves it forever?
Yeah. But a lot of the referrals a bit later on. I try not to treat babies 6 months and older because it's very difficult. But you can see, look at all the advantages here. You've got short hair, so the tape sticks. The first few weeks of life, the baby will stay at night in whatever position you put them in the cot, whereas 2 weeks later they're running around a bit. And the first few weeks of life, the baby can't reach up and pull things to bits.
So as a mother, Mary, you must have been kind of worried about doing it. Well, it's kind of two things, isn't it? You're worried about Ava growing up having an oddly shaped ear, but at the same time, you don't want to hurt her in any way. Were you worried about the ear buddy? I mean, she's got tape now, which is simply holding the ear in place. Does it annoy her? Is she in any pain?
I mean, it's not. I think it's a little uncomfortable when it starts to fall off. I mean, I do, as Dr. Gault said, you know, just change it when it's necessary. So it's almost hanging off. So when you take it off, it doesn't hurt too much. But yeah, it does hurt a little bit. But I think you've just got to look at sort of further along, really. You know, down the line.
It's a brave thing, I think, for a parent to do. I mean, you're doing it for the right reasons, but like I said, when you have a baby, it's so precious. You don't want to damage her or hurt her. So it's kind of a brave thing to do. But
I think I'm just looking like when she's older, you know, and if it avoids surgery, then I think it's a good thing. You know, that's what I like about it.
Well, what about the research? What evidence is there? I think it was something like 9 out of 10 babies it worked for. But have we seen the babies then grow up to an older age and the ears be fine? Do you know what I mean? Of the examples you've looked at, have you allowed for them to then grow and see if the ears are still okay?
What you said earlier on about it's a brave thing for the mum to do is the crucial thing. You see, if the mum's diligent, if the mum does it and keeps the tape on, applies the splints, it will either work or have a good chance of working.
Well, I can see an improvement already, to be honest.
That's the sort of thing that happens. Where the mum is a bit tentative about doing it and they put it on one night and don't do it the other, well, of course it doesn't work as well.
So what is the kind of maximum age? What's the oldest a baby can be or a child can be that you can use the splints?
Personally, I think it's a bit difficult beyond 6 months because the children do tend to often reach up and pull the thing off. But below that age, they cope with it very well. One time we put a splint in for a photograph in a child of 18 months and we forgot about it. 2 or 3 days later she still had it in and hadn't noticed it was there, so it doesn't cause a great deal of discomfort.
And just for people that kind of wanted to know, the sort of different conditions that earbuddies can be used for, a bat ear, lop, I don't really know what these things are, but bat ear, lop ear, cup deformity, Stahl's ear, cryptotia, is that how you say it?
Cryptotia, that's a hidden
Cryptotia,
ear.
rim kink, and I mean, what are they essentially, without going through each one individually?
Well, if the ear's all there, but is badly folded, you can reshape it with a splint. A lot of the patients I'm treating don't have an ear, and we're making them an ear, so that it won't work with there. You've got to reshape something that's already there. And, you know, there's a Stahl's bar is just a big kink like that. A prominent ear is one that sticks out and you're trying to put it back. A lop ear hangs down like that. And a cryptotia just means it's hidden.
If you don't treat them, I mean, is it a problem? I mean, or is it just something to look at that doesn't look so nice?
I think you've hit it right on the head there. I mean, it's a look thing.
It's
a
a visual
cosmetic thing.
Yeah,
because the ear itself, if it is cupped, it will receive sound slightly better, but we have a conventional thing at the moment that you don't look right unless your ears are tucked back very neat.
Mary, do you find that it affects her hearing at all? I mean, the tape's kind of covering a lot of her ear.
No.
Not at all?
Well, not that I've noticed, no.
Because that would be a problem, wouldn't it? Because doesn't their kind of balance and language development at that age, if they're not hearing correctly, isn't it?
I think you could cut the tape thinner. If you cut the tape, I mean, I haven't thinned the tape down, you could...
But if you put a very thin hat on your head, you still hear. I mean, it's not that we're blocking up the ear canal.
That's
we're just putting a splint in the rim.
If Ava was in a hat, you probably wouldn't even see that she's got the sort of tape there.
It does come with a hat as well.
It does come with a hat. Oh, it actually comes with a hat.
Yeah.
So this is it. You buy an earbuddy and it comes with the earbuddies themselves
or a little hat
and a hat
to hold it on with.
That's brilliant. That's a selling point. It is so. Also, I mean, the thing is, when people first came up with the idea of braces for teeth, it was probably a very similar issue, wasn't it? And ideally, I guess what you want is earbuddies to be as normal as braces. As in, for people to see a child with sort of a taped-back ear, for it to look as normal as a child wearing braces.
I
Just
think
doing the same thing.
That's exactly true.
Okay, long-term results that we've talked about. It's just it's a guarantee, is it?
Well, it's not a guarantee. It may not work at all, but if you're very diligent at reshaping the ear, there's a really good chance that you'll maintain that shape as the ear hardens.
And the conditions we've talked about, I mean, are these obvious conditions? I mean, immediately from birth? I mean, did you notice Ava's ears from day one, basically?
More or less, yeah.
And that is the best time to tackle it?
It is, but you've got to be very careful with your criticism about people that miss it at birth, because some babies' ears aren't actually prominent at birth, but as the head changes shape or regrows in the first few months of life, the ears may just kick out and become prominent then. So it's not unusual to find two groups of patients, some that present at birth and some that present in a couple of months.
And also, I just think it's important to say they don't have to wear the hat the whole time. I mean, it stays on with the tape. Yeah, and just to go back to the original story about your son, was it?
Yeah.
And how old is he now?
15.
15.
He's fine.
He is fine.
He's fine.
It's a great example. Okay, and you're obviously very happy with the treatment and will continue to use it.
Absolutely, yeah.
Fantastic. Mary, little Ava, who's been an angel, and David, thank you very much for coming in. Thank you.
Pleasure.
Thank you.